I started having pain 3-4 years ago, and I was kind of gimpy. I would walk, I would be fine, and suddenly my hip would catch, and I couldn't move. I had to realign everything so that I could move again, and that went on periodically for about 1.5 years, and then it became more chronic, and then it was happening every day, and then it was happening multiple times a day. In the meantime, I started working here in Erlanger, and so I started asking doctors, and I started asking the PAs, and I started asking the nurses, if you had to have your hip checked out, who would you go to? And a lot of them said, I would go to Case Sanders. And I said, okay. So I happened to be medically coding for the orthopedic team, and they were all pointing me to the same doctor. So I met with him, and initially we thought, this isn't bad enough to do anything about. Let's just push off for 6 months. Well, over the course of the next 2 months, it got significantly worse, unexpectedly. So I went back to him, and we did an x-ray. And I said, the x-ray, to me, doesn't look like it would warrant a surgery. And he said, yeah, it's kind of borderline. Let's get an MRI. So we got an MRI and found that there was a lot of soft tissue damage. There was degenerative damage, and it explained why I was catching. The arthritis in there explained a lot of the pain. So we decided we were going to proceed. I'm a researcher by nature. That's part of what I do as my job, and it's just something I love. So the first thing I did was let him know I wanted a little time to do some research. We talked about what the approach would be, and there are 3 approaches you can do for a hip. Posterior, which has been the most common, lateral, which came in, and now this new approach, which is anterior, which is from the front. So I wanted to see, what have other people said about it? What are the doctors saying about it? So I did a tremendous amount of research. And what I learned was really what was my experience. Dr. Sanders did a front approach. I did decide to have the surgery. In the beginning, the biggest difference, the thing that I loved so much, was in the first 2 weeks, I was on meds and I was recovering, but at the end of that 2 weeks, I could get in back with my life. I could come back to work. I could be with my kids. I could go and do things. I could go out to restaurants. I wasn't stuck with all these restrictions that I saw with the posterior and the lateral approach. I loved it. Now, I know that in the end, the whole picture, right, from beginning to end, the healing process of the hip takes the same amount of time. But the big difference for me is that initial part where I can start living again. And so I did. 2 weeks I was back at work, and I wasn't on pain meds anymore. And at about 3 weeks, I didn't have my walker, and I used my cane as necessary. And by 4 weeks, I was just rocking on. Dr. Sanders did more than was necessary. He was incredibly available. His nursing staff, his team, as a patient, they were there for me. I could call them. They were happy to talk to me. I couldn't ask any question that made me feel goofy or stupid because they just were happy to take good care of me.